Welcome back to part 2 of chapter 14, circulation. Pulse. The pulse that we feel when we put our fingertips over certain locations on our body is the heartbeat, that alternating expansion and contraction of that artery as blood flows through it. When you do take a pulse, you want to take it with your index finger and your middle finger, not your thumb. There is an artery close enough to the surface of the thumb that if we were to try to take it with the thumb, then you're getting confused with some pulse that happens in the thumb itself. So yes, take it with just the 2 fingers. There are several locations throughout the body where you can do this at. We're very familiar with the one in the wrist, but there are many others. Here is a list of the major ones. Please note that these pressure points or pulse points can be used to stop bleeding that in the body distal to that pulse point. Here is a diagram with the location of those, and again, you are probably familiar with the one in the lower arm. However, you can also feel it in the carotid, in your neck. If you feel for your windpipe, and then just go to the distal to that on either side and place your index and middle finger there, you'll be able to feel the pulse in that point also. Those are the 2 easiest, but you can locate them through several points throughout your body. I tried to find mine in a couple of these places, but after sitting for a while, some of them aren't as strong as others. So if you can't feel it, go do a couple of jumping jacks and then try again in those locations, and you should be able to feel your pulse in those different points. Effects of aging. As noted, the arteries do have a layer of elastic connective tissue, and just like the elastic in your underwear or your socks, after a period of time it becomes less elastic, and your blood vessels do that also. Because of that, the systolic blood pressure will increase, and remember, that's the top number. So as we age, this number will naturally get to be a little higher. Also, the baroreceptors, those are the pressure receptors that sense our blood pressure. They become more rigid and less sensitive. So when we change position, the cardiovascular system doesn't react as quickly because these baroreceptors are not as sensitive. So older individuals who go from a prone or lying down position to standing up, they may be initially dizzy for a few moments until these baroreceptors have time to adjust and cause changes in the cardiovascular system to adjust to the new position. Okay, we have talked about several of these disorders already, like arteriosclerosis and atherosclerosis. An aneurysm is when you get a ballooning. Instead of having a nice straight blood vessel like so, it pokes out in a spot. Okay, and given the right conditions, it can actually break, and when it does, then that's called a hemorrhage, and I think there's a few of those on the next slide. Gangrene happens when there's an inadequate blood supply to an injured area, and so it never heals, but instead starts to decay. In order to resolve that situation, it has to be removed. So you may have heard stories of like individuals in the Civil War who had an injured leg, and it just didn't heal, and then it had to be amputated. Hopefully with more modern medical interventions, that isn't as common. Phlebitis or thrombophlebitis is an inflammation of the lining of a vein. So if this were a vein right here, the lining on the inside of it becomes inflamed or swollen. Second, varicose veins. We talked about those in the veins when you get that poking out because the valves aren't functioning, you get pooling. And embolism is a traveling blood clot. So if you have a a vein or an artery, you got this little clot, and it's just floating through, and while it's in a larger artery or vein, it's just fine. But if it gets into a position where things are getting smaller, it can actually lodge and clot there. Hemorrhoids are basically a varicose vein of the tissue around your anal opening. So individuals with hemorrhoids will develop these enlarged areas in the anus, causing pain when sitting. Also, it may cause some issues when defecating. Cerebral hemorrhage is when you get a breaking of a blood vessel in the brain. Peripheral vascular disease occurs when there is inadequate or blocked blood flow in an artery out to an appendage. We talked a little bit about this. All of this information on this slide has to deal with blood pressure. We consider blood pressure as normal, 120/80. Pre-hypertension, if you're getting up to that 130 to 89. Stage 1 hypertension is considered up to, but not including, 160. So, and notice you only get a leeway of here, a smaller amount versus the systolic. Yeah, so they worry about that diastolic pressure. Stage 2 is you get 160 or above. And it is possible to have low blood pressure. Individuals who are highly athletic, if you have individuals that are, running like super marathons or triathlons, it isn't uncommon for them to have heart rates like in the 50s and a much lower blood pressure, like 40/80. So, but it can be a problem, even if it's being too low can be a problem also. There we go. A white coat hypertension. There are some individuals who have great blood pressure any other time, but if they see a white lab coat, it just sends them over the edge. So in situations like that, if they are especially worried about hypertension, they may send them home with some monitoring equipment for them to wear for a 24-hour period of time. So hopefully they will be without a white coat at some point in time there to determine what's really going on. Hypotension is when you have that low blood pressure, and again, it can cause issues with fainting. Transient ischemic attacks. In that situation, it's like a little mini heart attack. It's like a little mini it's not a heart attack, it's interfering with the blood flow to the brain. I'm sorry. Yeah, not to the heart. Usually it's because of some kind of a buildup in the carotid artery delivering oxygenated blood to the brain. And then a cerebral vascular accident. That sounds like you're having some kind of a car accident, but we know that more familiarly as a stroke. So that's when you get some kind of damage to the brain due to lack of oxygen to the brain, usually by some kind of a blockage. Hypoperfusion. Hypo meaning less than, not hyper meaning more than. So hypo is meaning it's not getting enough. Perfusion is that process in that capillary bed where the nutrients are being exchanged or coming out of the capillary bed. So hypo means you're not getting enough. So you're getting an inadequate flow of blood. If this happens for an extended period of time, those tissues involved will stop working, just like it does in a heart attack. You can think of a heart attack as a hypoperfusion of the heart. Okay? It happens often when people get very we refer to it as shock, hypoperfusion for the brain, when it's not getting an adequate blood supply, and fainting can result. Again, if it's happening to a certain specific organ, then that organ can die, and the causes are dependent upon the area of the body. If it's happening to the brain, it may be that you're experiencing shock because of circumstances, and then you faint, and then you're on the floor, and the hypoperfusion is resolved in that way. However, if it is because of some kind of damage, maybe the blood supply is being blocked to the heart or the stomach or the intestines, either because of some kind of an injury or a cancerous growth, then those tissues can die. So, how'd we do? Are you able to trace the path of the different circulatory systems? Not only the two major ones, but also those specialized ones like the portal or the fetal. Be able to list the types of blood vessels and be able to identify the different layers of blood vessels. Also, identify the major arteries and veins of the body, as well as be able to describe some of the disorders of blood vessels. If you can do that, then you will do well on these upcoming exams. And here's something to smile to get you on your way. And for all of those you watching the video, make sure I press the record button next time. Thank you.